Australia's first case of the coronavirus has been confirmed here in Melbourne.
I think the reaction to the first call about our first case was, okay, here we go. We've got this first case, we're just going to deal with it now.
Preparations ramp up for the inevitable spike in patients. 140 new beds are being opened early at Casey Hospital, and 7,000 elective surgeries are now being fast-tracked.
A state of emergency has been declared in Victoria.
Victoria started this crisis with 476 ICU beds. The goal is to create 4,000. This is that process in action.
And the overall setup is really to be able to provide vital support to our patients' critical functions.
At Casey Hospital, 12 ICU beds are ready, while at Monash Clayton, a temporary resuscitation unit has been built.
We've been planning to expand our intensive care unit capacity across Monash Health from its current 50 by another 200 beds if we need to.
The Red Cross is collecting plasma for 2 clinical trials.
If we show that convalescent plasma is effective for COVID-19, that strengthens the rationale for using it in future viral infections.
What's worrying medical experts is a sudden rise in the number of infections spreading within the community.
On our ward, we've got a wonderful speechy that had a great idea because we're wearing the mask and the shield, and so to patients we can look quite intimidating and quite scary. So we've all had a photo taken of ourselves which is laminated.
From 6 p.m. tonight, I am declaring a state of disaster.
My wife's in quarantine after an exposure from work at another health service, and we're missing her. I think we get to speak to her every day on the video conferencing, which is good.
Increasing our contact tracing approach such that we can integrate local community knowledge with the expertise and wisdom of our public health team.
Hi Helen, can you see me? It's Roger.
Hi, how are you? We've got lots of outbreaks in our nursing homes in Melbourne. I've been lucky enough to be able to go out and support the staff and the people that live there, and they're amazing.
It's taken 106 days, but we finally reached ground zero.
Yesterday declared Donut Day. 0 cases and 0 deaths for the first time since June.
Victoria's last active COVID case was a man in his 90s, discharged last night after 6 weeks at Monash Hospital, the same hospital which treated Australia's first COVID patient in January.
It's an amazing end to a 10-month cycle. And so as our patients leave, that journey is reflected for everybody. So it is an emotional time, and I'm just really proud of how the Monash teams have worked, how the Melbourne hospital staff overall of Melbourne have worked together to get to this stage. It's quite remarkable, really.